Hey, how's it going? Today, I am going to be doing a requested video, which is what kind of nurse I would like to be and what kind of prep I have to do before getting there currently. So stay tuned to find out. So the comment said, could you possibly do a video explaining about your third year and going on for nursing? For example, if you want to be an ER nurse, a nurse that works with children, infants, or even ICU patients, how you prepare, and are there like courses you can take and placements to choose specifically on your interest? Basically deciding what kind of nurse you want to be and what you need to do to get there. I absolutely loved this comment because, it's something I'm still kind of trying to figure out, but it's such a good idea to put my thoughts down here and then, reflecting on it even in the winter semester and thinking about it. So currently I'm going into my third year of nursing. I am not going to disclose which school I go to, but if you follow my Instagram or anything, it's really easy to figure out, or if you know me, yeah. So for third year specifically, you have chronic or acute placements, so I don't necessarily know how they work or if you're able to choose specific branches of the chronic or acute care. It's a little bit different this year because of COVID, so our placements are actually online. At least I have my chronic care in first semester, and those are going to be online. So I'll let you know how that goes. As for courses, there's an extension onto, so in second year I did a pathophysiology class, and then this year in first semester I have to do a pharmacology class, and there's an extension onto that is optional, and it is a very hard course. A lot of people say it's the hardest course you can take, and it is advanced pathophysiology and pharmacology. And with that course I'm able to get into a critical care placement in fourth year for second semester, and a critical care placement can be like ER, ICU, NICU, like any of that kind of realm. So my goal right now, so I did get into that class, and I did have the average to be able to get into that class. You need a specific average from pathophysiology and then pharmacology, and I'm assuming I will likely get that average in pharmacology because I did well in pathophysiology. And then the cutoff was 70, and I ended up with an 84 in pathophysiology, which is pretty hard, but it was alright. So I think I'll do alright in pharmacology, and I'll still be able to, playing with my lights, and I'll still be able to get into patho, or advanced patho and pharm. As for what kind of nurse I want to be, it's still super up in the air. I have so many plans that I kind of want to follow through with, but it's kind of difficult to choose one route. So in the summer I actually I've been a camp counselor, I've been a camp supervisor, and I've especially worked with special needs children. Especially in the last 2-3 years I've been working a lot with one-on-one with special needs children at camp. So my heart really goes to children. I really love working with children, and that's something I would love to continue with in the future potentially. The other side of me also is really into the thought of being in the ER and all that craziness. They call it unorganized chaos. I'm the kind of person that really likes thrills. I really like challenging, kind of changing environments, and I do really well because I get bored fast. So for fourth year for that placement, I don't know if I'll get it because it is competitive to get, but I do want to try to get an ER placement if at all possible. Of course I would do a critical care placement if possible because I did take that course, and I would have worked hard in order to get those placements. So yeah. And then after graduation, so after fourth year, obviously I'm going to get my licensing exam, do the licensing exam, the NCLEX, and become an RN. My goal is to work for a couple of years and then go back to school to get my NP, my nurse practitioner, so it's my Master's of Nursing, which also is a challenging program, but I currently have a much higher average than the acceptance rate, so I think I would be successful in that course. And I'm the kind of person, again, that really likes learning. I really like new challenges and stuff, so it really kind of makes me excited to learn more than what I have in my undergrad so far. So that's kind of my big plan right now. I also have a really strange obsession. I also have a really strange obsession with Australia, and I really want to do their travel work visa. So you travel for 6 months and work for 6 months in Australia. So you're there for an entire year, and that's like my dream right now to do. So I don't know if I'm gonna do that right after graduation, or before I get my NP, or after I get my NP. I mean, I guess it just depends on life, right? I've also thought about doing travel nursing. So a travel nurse is a nurse that goes, I guess, according to which country you're in. So I could do like Canada, US, I could even do Australia, and you fill in on a floor for a specified amount of time. So usually it's if they have a staffing shortage because of illness or mat leave or anything like that. So that's something I'm also pretty interested in. Being in third year, so only being halfway through, I honestly thought that I would have known more what I wanted to do, but I kind of learned more of what I do not want to do when I graduate. Like, I know that the long-term care environment would not be a suitable environment for me. I feel like I would probably get bored. Again, no offense to anybody that's in any of these like professions or career paths for nursing, but I really do need something that's super high paced and stuff. Even at summer camp, even though it's always changing and I always have a different special needs camper, I get bored sometimes. It's just I need change, and I think the ER or even ICU or something around that realm will definitely do it for me. I think I answered that question pretty well. The only other thing I would say is that it is changing, and again, I haven't had a ton of placements or a ton of exposure to placements, and what you see on TV and what you see on YouTube even from different nurses, I've found is sometimes different from the actual experience yourself. I was in the postpartum unit of a hospital as my placement, and I really thought that I would absolutely love it and that would be such a great place for me to work in the future. But I kind of came to realize that even that was slowly becoming boring for me. Even though I was only there for 8 weeks, I found that doing the exact same skills, the exact same assessments, pretty much the exact same findings with each infant and mom was, it was enough for me. I don't think I could do that as a career, even though going into it, I was like, well, I definitely could. And the first week I was like, oh yeah, I love this. But I need things that can change, and I need to be able to do more assessments than just, your average assessment. And I mean, you do get exposure to that in every placement that you have, in any career that you have, but I do need a kind of really high-paced environment in order to keep me happy. So yeah. I also wanted to note that I recognize that some of these work environments are difficult to get into, and they can be very competitive. So for example, coming out of university as a new grad nurse, it's highly unlikely that I would find like an ER job or an ICU job or anything like that right out of school. Most people go to like med surg or inpatient surgery or anything like that just to get that base experience. There's also like a critical care college that I've looked at, so you could work and do this at the same time, or just do this at the same time, and you do critical care, like it's like a critical care diploma, and it's like a year long. It's not very expensive, but it teaches you all the skills that you need to know to work in an ER and an ICU, and a lot of places do prefer that you have that certification before working there. So is that going to be another patch of education that I'm probably going to go through? Most likely. But again, I don't know what the future has in store, especially with COVID, and I don't know how placements are going to look in the future. But yeah, I just wanted to put this video out there. I loved the question. Thank you for sending it in. If anybody else has any video requests, please send them to me, because it makes me so happy thinking that my advice or even me talking about my future job could be useful to you. But yeah, so that's pretty cool. I think I'm actually going to continue kind of re-answering this question maybe every semester or every year, and just see where I'm at to give an update. I'm excited for third year, so I'm moving in on Sunday, and today is currently Thursday. So it's really exciting. It's the day that I upload this video that I will be moving in, which is pretty crazy. And as much as I'm scared for it, it's gonna be good. And I really hope that I get that critical care placement in 4th year. But yeah, thank you so much for watching. I really appreciate your view. Please subscribe if you haven't already. I really appreciate that too. And comment anything you would like. Video requests, talking about what you want to do with nursing, anything you find interesting. I love them all. So yeah, thank you for watching, and I'll see you in the next video. Probably not in this room, probably in my other room at school. But yeah, I'll see you then. Bye.